All right, folks, we're back now taking a look at some of the questions that our viewers are asking. And here's one. When should someone consider having their tonsils removed? That's from Fran R., Doc.
So tonsillectomies, or the removal of tonsils, is a relatively common procedure. Often you talk about it with children. Usually you wait until at least 3 years old when that child is of age or at that age to reduce the risk of things like bleeding. And there are some common reasons why adults get their tonsils removed. For example, severe sleep apnea, and even in less common cases, halitosis or bad breath. That can be associated with things called tonsillits, which are small stones in the tonsils that can make your breath bad, and that's one of the reasons why you get your tonsils removed. It is an important procedure. Although it is very common, it does come with its risks, so you definitely want to have a full understanding of what you're getting into before you go for it.
Your prescription for wellness.
Speaking of surgeries, we're going to talk about what you need to do in terms of your plan for pain during a surgery. So today's prescription for wellness are on some things you should talk to your surgeon about, especially when you're trying to plan for your recovery. Number one, you want to have a pain plan. Talk with your doctor about exactly what pain medication you're going to use regularly versus what medication you're going to use for breakthroughs, for example, when that pain acutely or suddenly increases. Also confirm your medication options. For example, we're talking about over-the-counter medications. Some surgeries do well with Tylenol, some do well with ibuprofen, but you want to make sure that you have an understanding, because even over-the-counter medications can come with their own risk. And then those stronger medications you want to have available to you. Also ask about when you can exercise and when you can start physical therapy. That's really important, especially when you're trying to figure out when you can get back to your regular life. And then know the red flags. If that pain is increasing out of proportion, that pain medication is not helping, or if you have symptoms of an infection like a fever or redness around the surgical site, that can be a sign of a problem that you need urgent attention for.
All right, Doc, thank you. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for Dr. Darien at ABC GMA3.